Hi, my name is Steven Diaz. I got to talk about um, partial orals versus intravenous antibiotic treatment of the endocarditis. Definition: endocarditis is an infection of the heart inner lining. Usually immobile, the heart bears which forms the endocardium. Normally is caused by a bacterial infection which goes into valvular vegetation.
Hey guys, Nurse Mike here, and welcome to SimpleNursing.com. Before we get today's lecture started, please remember to access your free quiz and preview our cool, nifty new study guides, not here on YouTube. Click the link right up here at any time during this video. All right guys, let's begin! So the easy way to remember all the main causes, use our acronym DRUMS because your heart kind of acts like a drum. So D is for dental or oral surgery. We give prophylactic antibiotics and also degenerative heart disease called Marfan syndrome. Now R is for resistance to major antibiotic. Even if your patients take these prophylactic protective antibiotics before their dental appointments, guys, they might not even work if they have long-term resistance to major antibiotics. Which brings up our next point, U. U is for untreated strep throat and even untreated rheumatic fever. This is a main cause here, huge test tip. Untreated strep throat can lead to an even nastier infection called rheumatic fever, aka rheumatic heart disease, and then to endocarditis, and then to death. Who would ever thought that a sore throat could lead to a broken heart? So M is for major heart surgery. We all know that repairing heart valves can be risky, but even CABG, so yes, a CABG, a coronary artery bypass graft for heart attack patients, or even implanting pacemakers. So guys, anything that opens the heart up during surgery to any possible infections is a huge risk for endocarditis. And lastly, S is for sticking dirty needles, even for medical use, tattoos, and even piercings. Guys, anything that opens your body up to infection, whether it's opening your chest for heart surgery or opening the skin with dirty needles, or even opening your gums in dental surgery. It all revolves around protecting your patients from infection. So guys, especially patients with history of heart problems, they're the most at risk. Now for diagnostic tests for infective endocarditis, we do both blood cultures and an echocardiogram. The blood cultures help pinpoint which kind of germ it is so we can match it better to a drug that will kill it best. This is called... Thanks for watching.
Application in medicines. Patients with infectious endocarditis on the left side of the heart are typically treated with intravenous antibiotic agents for up to 6 weeks, where are shifted from intravenous to oral antibiotics once the patient is in stable condition will result in efficacy and safety similar to those with continued intravenous treatment in of now.
Dr. Pedersen, you helped chair the new guidelines from AATS on the treatment of endocarditis. Can you talk about the takeaway messages of the new guidelines?
Yeah, I think we have arrived at the point now when everybody seems to recognize the role of surgery in the treatment of endocarditis. And from everybody or many being questioning the additional value of surgery, everybody is now on board that there are patients with endocarditis who are helped by surgery and could only be cured by the combination of surgery and medical treatment. And the next step, once that has been recognized, is that once you have an indication to operate, there is no reason to postpone this operation. But early surgery, I think, is also very established at this time. Once there is a serious problem that cannot be cured without surgery, go to the operating room. And it's very important, of course, to have a bacteriological diagnosis and make sure that we have the right antibiotics on board. And I think that we need to hear a little bit more about what we have available when it comes to diagnostic possibilities.
Whenever we have disease, it's always the best to establish a diagnosis from the tissue that is affected. So in the case of surgery for endocarditis, if a diseased valve is taken out, it is too much of a waste if we don't do anything with that valve. So it really should be standard practice that these valves should be looked at histopathologically, firstly to confirm that the diagnosis is really endocarditis. And what we are doing there is looking for evidence of inflammation on the excised heart valve. In addition to that, we have an opportunity to identify the microorganism that is actually causing disease. In the past, the usual way to identify the microorganism has been by culture. But we have to recognize that by the time patients go for surgery, they've been on antibiotics for several days to several weeks. And the valve cultures are negative more often than they are positive, even in patients with active endocarditis. And so the better test these days is actually to do microbial sequencing on the heart valve. And in the vast majority of cases with endocarditis, the valve sequencing results are actually positive, and that would help us identify the exact microorganism.
Dr. Griffin?
So I think one of the things we've learned at Cleveland Clinic about endocarditis is that it's a team sport, that it requires a team approach to its care. These are very sick patients oftentimes, they're at great risk, and so we have developed a team involving our cardiac surgeons, our cardiologists, our infectious disease physicians, our neurologists and other physicians to manage and to diagnose these patients. And so diagnosis often involves advanced imaging, not just common echocardiography, but more advanced echocardiography using transesophageal echo and even three-dimensional approaches, and also using newer techniques such as CT and MRI. So we have developed this kind of team expertise, and we've learned that bringing people to surgery when that's needed early has led to improved results.
Thank you.
Pros and cons. Partial orals. Pros. Is the most widely used way of administration of drugs. Cons. It can be used in the patient with difficulty swallowing, with vomit, or if they are unconscious. Intravenous antibiotics. Pros. Is the fastest method to introduce a medication into the circulation. Cons. Very fast administration can cause undesirable effects.
This is a big one, antibiotics. A lot of parents worry about giving them. Is overuse becoming a problem?
Absolutely. Unfortunately, overuse is a big problem because overuse of bacteria causes something called bacterial resistance. So the bacteria, the common bacteria that we've always had around, are morphing and changing and becoming resistant to the bacteria, to the antibiotics that we have created. And we actually have not created new antibiotics in many years.
That's
so
right.
We're still using the same ones. So it's very scary.
So do you have a lot of parents come in and they say, you know, or grandparents or caregivers, you know, I need antibiotics for my child, and you say, well, I don't think you need them, and they say, no, I need them.
Absolutely.
It's not easy.
It's very difficult because medicine is not black and white. Medicine is really, it's truly an art. And, you know, I had attendings that used to tell me that, and mentors, and I never understood until I came into practice. You know, there's the psychosocial aspect of the family, there's the relationship you have with the parents, and then there's the actual illness that comes into play.
Yes.
And it's very difficult because some families say, well, I know it's going to progress in 3 days because this always happens to my child. I don't want to come back. I can't take off of work again. Please give me the antibiotics now. Or we're going on out of town and I don't want to get stuck out of town without antibiotics. Please prescribe them to me now. Or just, I think that it'll work. So-and-so's done it before, it's worked before, so I want it now.
Exactly. And not only the antibiotic as a whole, it's a good thing if it's needed and used correctly.
Right.
But there can be side effects.
Exactly.
And I'm allergic to penicillin.
Okay.
I blew up in a rash or something. Case in point, my daughter the other day had to take an antibiotic with sulfa.
Oh, yes.
I don't even have to tell you.
Yes.
Poor child, covered in a rash
Yes.
horrifically, so now she's jotting down that allergy. You have to be wary of the fact that if you're starting an antibiotic, that could happen.
You could possibly be allergic. Also, antibiotics, they kill the bacteria in your body, good or bad. It kills the bacteria that's causing the infection, but it also kills the good bacteria that we have in our gut. As a result, you develop diarrhea or a very, very severe infection called Clostridium difficile. And we've seen that on the rise in the pediatric community.
Issues applying in Ecuador. In the Ecuador, high doses of intravenous antibiotics are used in the hospital. The doctor will use dog cultures to determine which organism is causing the infection.
Empiric intravenous antibiotics are often indicated when a patient is admitted to the hospital with an infection and can be life-saving. However, many patients can adequately complete their course of therapy with targeted oral antibiotics after they begin to clinically improve. Switching to oral antibiotics when appropriate can decrease costs, facilitate discharges, and save patients from complications associated with indwelling intravenous catheters, including infection and clots. Some life-threatening infections are not eligible for an IV to PO antibiotic switch, including meningitis and endocarditis. However, many other commonly encountered infections are, including community-acquired pneumonia, skin and soft tissue infections, and urinary tract infections. A patient is eligible for an IV to PO conversion of her antibiotics if you can answer yes to the following questions. Number 1, is the patient improving clinically, and is she hemodynamically stable? The answer to this question relies on clinical judgment and may include consideration of the patient's fever curve, improvement of presenting signs and symptoms of infection, white blood cell count trend, in addition to overall vital sign stability. Number 2, is the patient tolerating food or enteral feeding? The presence of tube feeding should be taken into consideration if the patient is going to be converted to oral therapy. There are certain antibiotics, specifically the fluoroquinolones, whose absorption and effectiveness are reduced in the presence of enteral feeding. This effect can be minimized by holding tube feeds 1 hour before and after drug administration. Number 3, is the patient able to adequately absorb her orally administered medications? Or otherwise stated, is the patient taking other important medications, such as cardiac medications, orally? Patients with persistent nausea and vomiting, and active gastrointestinal bleed, or those with ileus, malabsorption syndromes, or proximal resection of their small intestines may not be candidates for oral administered antibiotics. Patients with persistent nausea and vomiting, and active gastrointestinal bleed, or those with ileus, malabsorption syndromes, or proximal resection of their small intestines may not be candidates for orally administered antibiotics. Number 4, is there an orally bioavailable antibiotic that would adequately treat her infection? Bioavailable oral antibiotics are those that achieve serum and tissue concentrations comparable to IV to PO antibiotics. Bioavailable oral antibiotics are those that achieve serum and tissue concentrations comparable to IV administered antibiotics. Bioavailable oral antibiotics that are commonly used in practice include all fluoroquinolones, doxycycline, azithromycin, trimethoprim sulfamethoxazole, metronidazole, fluconazole, and cephalexin. Linezolid also has excellent oral bioavailability, but is expensive and may require significant copays. Other antibiotics with good and in most cases adequate oral bioavailability when dosed appropriately include amoxicillin, amoxicillin clavulinate, and cefpodoxime. In many hospitals, protocols allow pharmacists to interchange IV formulations with orally bioavailable formulations of the same